Injury and medical procedure. So we'll be using the an acronym PRICE, which is protection, rest, ice, compression and elevation. So first want to protect the area from further injury. For example, putting a sling or covering it up for extra support. Give it rest, so avoid further exercise in the session. Sit out, either use a walking stick, crutches, that sort of thing, depending on how major the injury is. Ice, put an ice pack on it for 10 to 30 minutes, so like a bag of frozen peas, something like that will do. Wrap it in a towel and avoid it touching directly to your skin because it can cause ice burn, so you want to just put it in a tea towel on the designated area and just dab it on. Compression, keep the bandages compressed enough but not too much so it doesn't cause swelling in the arm, so it increases blood pressure too. And then elevation, so if it's like the leg, you want to sit down somewhere so you can rest your leg, so it's off the floor on a chair or table or something, so it reduces the swelling and so it gets better quicker.